Good afternoon, everyone. I'm Dr. George Fontabi, MD. I'm currently a physician in the Miami area. I'm board certified in family medicine. I'm here to speak about the coronavirus and this new global crisis that's going on. It's unfortunate for the lives that are lost, and I want to say I'm sorry for the families that are suffering at this time with all of these conditions that are worsening for their family members. My heart goes out to them and all the people across the world that are suffering as well. But I want to highlight some things that are going on that maybe been misinformed across the media outlets out there, and just to help with the fear of the American public with this virus that has been really affecting multiple lives across our world. The coronavirus is a very common virus as far as the family of viruses of corona. There's several strands of the virus family that have been noted in the past few years. Of late, obviously, this new virus has morphed into something a bit less common. It's become a lot more contagious and it's easily spread. So it's been the goal of us as physicians and other healthcare professionals and the people in the community to kind of help aid people in understanding that we need to keep our hands clean, avoiding close contact, staying out of large public crowds, and making sure that everyone is getting adequate medical attention if needed, if the symptoms are worsening and persisting. I think these are very important things that we should discuss. Multiple people have asked me questions about particularly the Black community and how it would be affecting those people. And I would say this, that it's not necessarily a race thing or who's going to be affected more. It's more a demographic thing, right? So people that are Latino and African American descent that are working in public workplaces, right? Child care laborers, people that are working for the banks, people that are working in restaurants, in the hospitality world, people that are working in places where they're doing public service, community leaders. These people are much more at risk because of the large crowds and being able to spread and also contract the virus. I think it's also important to say that this virus is not quite what we would consider the most deadliest virus we've seen. Out of about 150,000 cases worldwide, we've relatively had about a 70 to 75,000, I believe I've seen so far, and going up have totally recovered, which is about 93 to 95% of all of the cases. About 5,700 cases have been considered critically ill, and deaths have resulted from them, with people with multiple medical conditions who are over the age of 60. None under the age of 10, I believe, has even had any critically ill issues. Very mild. The children have seemed not to be really affected, as well as pregnant women. Our healthy adult population have been relatively safe. There's obviously been some sports players that are very popular in our world, the NBA, that have contracted the virus. However, pretty confident, I'm sure, as well as there are other physicians out there, that those people will recover very quickly because of a healthy immune system. I've constantly harped on the fact of immunity being the biggest issue with this world right now, that we have to make sure that we're eating correctly, we're keeping our hands clean and washed, and making sure we're doing things to contribute to boosting our immune system. So the stress and hysteria is much understood. However, the virus is noted. We know its potential harm. So we should be able to focus right now on the things that are going to help boost our immune system. The communities that have the most diabetics, the people that have hypertension, high cholesterol issues, and heart problems that are already pre-existing, cancer, these people are the ones that we need to protect and make sure that we don't spread the virus so they don't get them. The healthy individuals, we're not so worried that you won't recover. It's the spread of those who may not be able to recover despite our medical efforts. So I think that's one of the biggest things that I'm trying to harp on today for our public to understand, is that we've got a pretty good grasp on the virus. We know it's easily contagious. And so the president, with his efforts to try to quarantine and shut down certain places, was really a solid one, I would say, because of the fact that if we can make sure that the virus doesn't continue to spread, then the people that are infected can stay in their homes, stay away from others, and the virus will kind of do its thing over the next couple weeks. And it was the curve that they were describing on the State of the Union, the State of Emergency address yesterday, makes sense. The curve will then now drop. Not like the other countries who didn't obviously have enough time to make those abrupt changes to their world, and so they were affected much greater than we are trying to prevent. So I believe that as long as the American public and the people of our communities understand these things, I think we can have a really, really, really good outcome and a much faster, speedier outcome. So make sure the take-home points are today: keep your immunity up to to par. Make sure you keep your hands clean and washed. Avoid large public crowds. Stay at home if you're sick. I know there's test centers out there that were delegated to confirm if you've been positive for COVID-19, but remember this: if you're not having symptoms and you go to a place where people are having symptoms, now you most likely have infected yourself with not only maybe the coronavirus, but maybe adenovirus, rhinovirus, influenza viruses, which are still very prominent viruses in this season that can also cause similar symptoms. So stay hydrated, keep the fruits and vegetables, and do the right thing. From Dr. George Tabby, MD, down in Miami. Thank you guys so much.